a Kilgore College student nurse. How are you today?
I'm good. How are you?
I'm good. Thanks for asking. Can you tell me your name and date of birth?
Cassie Aiken, 3395.
Okay. Can I see your wristband?
Yeah.
Okay. Miss Cassie, do you have any allergies?
No, ma'am.
No allergies? Okay. Can you tell me your last bowel movement?
I think it was yesterday.
Yesterday? Okay. 97. And can you put this on your finger for me?
Yes, ma'am.
All right, Miss Cassie. Have you had any coughing lately?
No, ma'am.
Okay. What about your bowel and urine pattern? Are those pretty frequently?
Yeah, I do get constipated quite a bit, but other than that, I'm fine.
Okay. Can you tell me what brought you in today?
To do a video with you.
Okay. And can you tell me where you're at?
I'm at Kilgore College.
Okay. And do you know what time of day it is?
It's the afternoon.
Okay. And then do you know who the president is?
Yes, it is Donald Trump.
Okay. And that's 99% of room air. I'm going to take your pulse. Is that fine? Do you have a preferred hand?
We can do this one. Let me just go ahead and take my watch off for you.
Okay. Okay. Got 82 for your pulse, and then your respirations were 18.
Okay, yes, ma'am.
Okay. Next, I'm going to get your blood pressure.
Okay.
Can you tell me what you've eaten in the last 24 hours?
I had a Alani for breakfast, and then I had a grilled cheese with some sweet tea at lunchtime.
Okay. Is that normally what you have in a day?
Yeah.
Okay. And never mind. Can you tell me your baseline?
It's usually around 120 is the top number.
Okay. Right, if you will, cross your feet for me.
Yes, ma'am.
$120/82, right on. Can you tell me your height and weight?
Yes. I'm 5'5", 130 pounds.
Okay. Can you tell me on a pain level of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt? Can you tell me what you're feeling today?
A 0.
Okay. All right, Miss Cassie, we're just going to begin our head to toe assessment. Is
Yes,
that
ma'am.
okay?
Yes.
Okay, first I'm just going to start with your head. I'm going to put some gloves on.
Okay.
All right, and you tell me if at any point you feel some tenderness.
Okay. No, ma'am.
Okay, let me switch my gloves. Put new gloves on, and I'm just going to feel your face. If you
Okay.
feel any tenderness, let me know. Okay, and then I'm just going to go down and feel any tenderness.
No, ma'am.
Okay, shrug for me. Okay, and then while we're here, if you push and push. Okay. Now I'm just going to be looking at your eyes, your nose, your mouth, your ears. Okay.
Yes, ma'am.
So if you will, just look out at the wall for me, and don't look at my light.
Okay.
Okay, can you take your hands and pull your eyes down? Perfect. All right, now if you will, you're going to look out straight in front of me. When you can no longer see my pen, let me know.
Okay. Right there.
Okay, other side.
Right there.
Okay, now you're going to follow my pen with your eyes.
Yes,
Don't
ma'am.
move your head. All right, now follow it all the way in. There you go. Now I'm just going to take a look at your ears, okay? Okay, now we're gonna do this, so I want you to cover that ear with that hand.
Yes,
And
ma'am.
I'm gonna whisper through things over here in this ear, and you need to repeat them back to me.
Ball, blue, shoe.
Good. All right, now let's go to the other side. We'll do the same thing over here.
Yes, ma'am. Car, dog, door.
Okay. Next, I'm just gonna be looking in your nose, so if you will look up for me. Okay. If you'll take your finger, place it over your nose, go. Do the other side. All right, if you will, open your mouth. Okay. Next, I'm just gonna have you look over that way. Okay, look over that way. Okay, next I'm just gonna check your pulses. Okay, we'll check this pulse. Alright. Next I'm gonna be checking your lungs. So we're just gonna
Okay.
start with the back. And then I'm
Here,
just
I'll
gonna
look
look.
this way.
Okay.
Is that okay?
Yep, that's okay. Alright, back. Just gonna do a little palpate back here. Okay, and then every time you feel my stethoscope, if you will, take a deep breath in.
Yes, ma'am.
Okay. All right, I'm gonna move around to the front. Do the same thing. Now I'm just gonna be listening to your heart, okay?
Okay.
Breathe regularly. If we will, take your hand, lift your breast for me. Okay, and then I'm just gonna feel.
Okay.
Okay, and then I'm just gonna feel here. Make sure everything is good. All right, next I'm gonna be checking your abdomen. So if you will, lay back for me. Are you having any tenderness today down there?
No, ma'am.
Nope. Okay. If you will, just relax. I'm just gonna listen. Okay. Next, I'm just gonna do a little tapping and a little feeling, okay?
Yes, ma'am.
Okay, now I'm doing a little feeling. There's no tenderness, correct?
No, ma'am.
Okay. If you feel any tenderness, you let me know and I'll stop.
Yes, ma'am.
Okay, Miss Cassie, I hope you sit up.
Okay, thank you.
All right, now we're just gonna be doing a little range of motions. I'm gonna be feeling some pulses, capillaries, okay?
Okay, yes, ma'am.
So, if you will, flip your wrist over for me and I'm just gonna feel.
Yes, ma'am.
Okay, and then if you will, grab for me. There you go. Now you're gonna place your hands out in front of you just like this, and you're gonna follow everything I do. Now flip them, pull them in, bring them out, bring them up, bring them all the way around.
Yes, ma'am.
There you go. All right, and then I'm gonna check your capillary refills. Okay, over here. All right, that looks great. Now I'm just gonna go down and check your legs, okay?
I'm sorry, I should have took my socks off.
No, it's okay. If you would, go ahead and take your socks off because I'm gonna look at your toes and check your capillary refills. Alrighty, first I'm just gonna feel
Okay, yes, ma'am.
warm. Let's see. No edema, and then I'm just gonna check.
So sorry. I need a pedicure.
No, it's okay. And I'm just gonna spread them, make sure there's no cuts or anything in between. And then if you will, just scoot back on that exam table for me. We're gonna do a little range of motion up there.
Put the socks back on before we do that.
Is that okay? Yeah, that's okay.
I didn't know if you needed my feet anymore.
No, that's good. You're good. All right, so the first one, you're gonna bring your knee to your chest, whatever leg you want. Put it back down. Other leg, back down. If you will, pick it up off the table for me. Back down, other foot up and back down. Now, if you can, try to go out and rotate those hips. Same thing the other side. All right, now give me a little push. Push, 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 pull, pull, pull. All right, if you will scoot down for me. Let's see. Okay, we're gonna do this. So I want you to go 1, 2, 3, 4, 5.
Yes, ma'am.
1, 2, 3, 4, 5. Okay, and then if you will, take your finger, put it on your nose, and then you're gonna touch my finger 3 times. Go.
With the same finger?
With that same finger. 1, 2, 3. Okay. Let's see. That's it. All right. Well, let me put you back down. All right, and
Thank
you're in a
you.
comfortable position. I'm about
Yes,
to do some
ma'am.
documenting, and then the doctor should be in shortly.
Yes, ma'am. Thank you.
You're welcome. Okay, so my patient is alert and oriented times 4. Her position was erect, but she was comfortable. Her skin color was evenly distributed and appropriate for age and ethnicity. She had an adequate nutrition status. Her hearing was a 3 out of 3 with the whisper test. Yeah, she's calm and cooperative. Her personal hygiene was well. No lumps, bumps, lesions or tenderness to the head. No lumps, bumps, lesions, or redness noted to the eye structures or the sinuses. Let's see, her cardinal field was intact. Peripheral was intact, Perla noted. Her ears, there were no obstructions in the ear, and there were no deformities to the ears. Her nose, there was no deviations, and patency was clear. Her mouth was moist, no lesions, no JVD noted to the neck. Pulse, carotid pulse was 2+. Neck and shoulders can shrug against resistance. No history of coughing. Let's see. Bowel sounds. No, let's see. Her chest. Her chest symmetry was good. Her respiratory effort, she was even and unlabored. Breath sounds were clear to all lobes bilaterally. Resonance noted. Her PMI was also noted. S1 and S2 noted. Her radial pulse, popliteal, posterior tibial, and dorsalis pedis were all 2+. Her skin was warm and no edema noted. Her no bowel issues. She has regular bowel movements. No distension noticed. Normal active bowel sounds. Let's see. Tympany noted during percussion. Let's see. There were no lesions between the toes. Capillary refill to upper and lower extremities were less than 3. Let's see. Respiratory. S1 and S2 were present. Let's see. Patient was comfortable position when I left. Full range of motion to upper and lower extremities. Everything is intact to right and left upper extremities. Let's see. Eyes, nose, mouth, ears, chest, stomach, hands, feet, legs. All right, I think that's it.